Thank you for joining us for today, and welcome to today's session on the vome ventilator from React Health. This is a mini educational session designed as a refresher to help you prepare for your next vome setup. This is not to replace any formal training, rather should serve as a quick review. On behalf of myself and the entire team at React Health, thank you in joining us for today's session. Now, let's dive into the vome ventilator. Let's dive into the vome ventilator. The vome ventilator is a part of our comprehensive ventilation portfolio. It provides continuous or intermittent ventilatory support for the care of individuals who require mechanical ventilation. This versatile device may be used in both invasive and non-invasive applications and is intended for pediatric through adult patients weighing at least 5 kilograms. The vome is intended for use in the home, hospital, institutional, transport settings, including portable applications. First, let's identify the vome ventilator. On the back left of the ventilator, you will see here, next to configuration, it reads vome. Right here is where you will find the low pressure oxygen inlet. Here is where you'll add any low flow oxygen using a standard oxygen adapter. The vome ventilator can accept up to 20 liters per minute of low flow oxygen. Please refer to the policies and procedures of your institution on oxygen for ventilator patients. Next, I want to highlight the 2 filters located in the back of the ventilator. The first is the air inlet filter. Next, you will find the fan filter. These filters should be cleaned every 2 weeks and replaced every 6 months, or as needed due to policy. Additionally, please notice the connection for our power cord. Position the power cord at about 3 o'clock on the back of the ventilator and plug it in. To ensure the connection, rotate the connector until the LED light on the front of the ventilator illuminates, indicating that the ventilator is now plugged into AC power. Next, I will highlight a few other key aspects of the vome ventilator. Please take note that there is a door next to the oxygen inlet. Behind this door, you will find a USB port. The USB port serves multiple purposes, especially in relation to connectivity. This USB port is used to connect a USB stick or modem. If you need login credentials or more information, please reach out to your local clinical leadership team. Next, let's discuss the external bacteria filter. Here, you notice that this is the React Health external bacteria filter. This proprietary filter is essential, so make sure that you have the correct part number for your setup. You will notice that there is a prominent notch on the top of the bacteria filter, as seen here. You will also notice that there is a notch on the top of the inlet. Please make sure that you align both notches and turn a quarter turn. This will lock the external bacteria filter into place. To remove it, rotate a quarter turn counterclockwise until the notches align once again. The external bacteria filter is intended for single patient use. Replace the filter between patient uses whenever it becomes soiled or damaged, or every 30 days at a minimum. Follow your healthcare institution's protocol for replacement criteria. So now I'm going to go ahead and lock that bacteria filter into place. Again, align both notches and turn a quarter turn. Now, let's discuss battery life. The vome ventilator has 2 detachable batteries on either side, plus an internal battery. With ventilation at nominal settings and new batteries, approximate runtime is 6 hours on a set of removable batteries and 2 hours on the internal rechargeable battery, with a total runtime of 8 hours between 3 batteries. Next section, we'll review circuits compatible with the vome ventilator. The vome is compatible with 3 primary circuits: valveless, passive, and mouthpiece. Shown here is a valveless circuit. This can be used if utilizing a vented mask to provide ventilation therapy. Valveless circuits do not include an exhalation valve and are designed for use with a mask incorporating a fixed leak or a high flow cannula. Shown here is a passive circuit. A passive circuit can be connected to a trach or non-vented mask to provide ventilation therapy. This circuit type includes an exhalation valve designed to expel exhaled gases. For more information on circuits compatible with the vome ventilator or other configurations, please reach out to the clinical leadership team or reference the instructions for use. Now, I am going to power on the ventilator and walk you through next steps. Please take special note of the connection that you see here. A passive circuit, which is a circuit with an exhalation port connected to a hard-sided test lung. Remember, the vome begins ventilating when powered on. This optional hard-sided test lung may be utilized for an enhanced clinical setup experience. We will power on the ventilator by pressing the power button located on the front of the vome. Once the ventilator powers on, you will see a screen that reads Simple Mobile Care Changing. Next, you will hear 2 beeps. Next, we will focus on menu navigation, starting with the pre-use test. Please perform your pre-use test under the conditions outlined in the instructions for use. The pre-use test calculates the resistance and leak of the Ventec 1 circuit. Based on these calculations, vome verifies the integrity of the circuit while also improving the accuracy of therapy delivered. If you have increased resistance in the bacteria filter, the pre-use test will help this. First things first, you always want to make sure that as the clinician, you are taking a look right here at the top of the screen. It says, ventilation is active, NIV/valveless circuit. If you are setting a patient up for non-invasive ventilation, ensure the circuit that is stated on the screen is the circuit that you are using. To begin the pre-use test, press the next button here. You will see that ventilation is paused. It states to keep the end of the circuit open when performing this step. I'm going to select on the Start button. You will notice that the resistance measurement is now in progress. Next, I'm going to block all airflow at the end of the patient circuit and press Next. Compliance and leak measurement is in progress now. Now I select on Start and ventilation is active. Okay. In the next section, we are going to focus on inputting settings into the ventilator. First, you must unlock the ventilator. To unlock, go to the Menu tab and select on Clinician Access. Please enter your passcode for clinician access. Your passcode is the last 4 digits of the ventilator serial number. You can find this by looking on the sticker on the back of your vome ventilator or by selecting on the My Voxen button. This will contain your full serial number. Again, please type in the last 4 digits of your ventilator serial number. Once you add in the 4 digits, you will see that the padlock on the upper right-hand corner changes to an unlocked padlock. Now, let's move forward to inputting settings in the vome ventilator. To begin, select on the Therapy tab. Next, select on V for ventilation. Next, navigate to the Settings and Alarms tab. You will notice here that you have the ability to set up to 3 total presets or prescriptions. Next, I'm going to walk you through setting a patient up in volume targeted pressure support mode. Now, you will notice on this preset, the preset label is already NIV. You have the ability to adjust or customize the preset 1 label to fit your patient's needs. Next, I'm going to scroll to the patient type. You will notice here that the patient type is in adult. This corresponds to the type of circuit that you are using. Your options are pediatric or adult. Next, you will notice humidification. You have the option to select on HME or humidifier. If the patient is using a humidifier, you would simply select on humidifier. If not using a humidifier, you can select on HME. Next, you will see circuit type. The circuit type is already on a valveless circuit. Please take note. In order to change the circuit type or mode, you will need to go into preset 2 and adjust it there. Next, you will see settings that you will fill out based on your prescription. If I scroll here, you will find a minimum pressure support and a maximum pressure support. If you would like to enable IntelliPAP, you would simply select Edit and toggle on IntelliPAP. Under that, you will find other key settings that are very important to make sure that you customize to optimal patient response. First of those that we'd like to focus on today is flow trigger. The second is flow cycle. If I edit flow trigger, please keep in mind that flow trigger can be set anywhere from 0.5 liters per minute to 9 liters per minute. 5 liters per minute is our most sensitive flow trigger. Please make sure that you always customize flow trigger for optimal patient response. Next, you will find flow cycle. Flow cycle can be set anywhere from 90% to 10%. This is what is going to transition the patient from their inspiratory phase to their expiratory phase. Spontaneous breaths will cycle at the set flow cycle percentage of peak inspiratory flow. Setting the flow cycle control to 90% will result in a shorter inspiratory time. Setting the flow cycle to 10% will result in a longer inspiratory time. Please make sure that you understand how to set flow cycle appropriately in order to titrate for optimal patient response. Key takeaway for flow cycle: the higher the flow cycle percentage, the longer the patient has to exhale. If I continue to scroll, I will find other settings, including rise time. These are all settings that should be customized for optimal patient response. Once I scroll down, I will now show you the alarms portion. Please make sure that you are following your policies and procedures for alarms and using your clinical acumen to set alarms appropriate to the patient. One area of focus that I want to draw your attention to today is the high inspiratory pressure alarm. Please make sure that your high inspiratory pressure alarm is set appropriately. If set too low, it can limit your algorithm range potential. So we've made it through the settings and alarms portion of this presentation. Next, I'm going to show you how to enable high flow therapy. To enable high flow therapy, I'm going to go to preset 2. Note that you will only find high flow therapy under the mode SIMV pressure or SIMV volume. Once I establish that I am in either SIMV pressure or volume, you will find the option to turn on or enable high flow therapy by moving the toggle. Next, I'm going to press accept. Now I have the opportunity to set flow by pressing edit. Please keep in mind that this is the total amount of flow being delivered to the patient that consists of an air and oxygen mixture. The device is controlling to the liter flow that is set, and your oxygen is still bled into the back per the user manual. For high flow therapy, the air is being generated from the blower of the ventilator itself. So I'm going to start by setting the flow at 30 liters per minute. To do that, please do take note that you have the opportunity to set alarms in accordance with your policies and procedures. Once alarms are set appropriately, I am now going to select on the exit button. Now I have the ability to switch between my NIV preset and my high flow therapy preset. If I would like to switch to high flow therapy, I would simply enable preset number 2 by selecting on preset 2 and selecting the start button. Now it gives me the opportunity to do the preuse test. You, as the clinician, now have the ability to select next on the preuse test. For the purposes of today's presentation, I'm going to select on exit. Now you are delivering high flow therapy. To review, to input settings into the ventilator, we always go to therapy, ventilation, settings and alarms. If you're setting a patient up for volume targeted pressure support, then you can simply input the settings under preset 1. If you must change the mode or the circuit type, please make sure that you input those settings into preset number 2. This concludes today's session on the vome ventilator. Hopefully, you found this session to be valuable. For further information, or if you have additional questions, please reach out to your local React Health representative or contact info@reacthealth.com. Thank you again.